Welcome everyone. Myself Rudra Mol R, Assistant Professor, Department of Anaesthesia and OT Technology from Yenepoya School of Allied Health Science. So welcome everyone to the topic Ultrasound Sonography in Operating Room. So upon completion of the session, the audience will be able to know about the application of the USG in anesthesiology, definition of ultrasound imaging, and list out the steps taken in ultrasound machine care and maintenance. So starting with the introduction, so the ultrasound imaging is defined as simple and non-invasive technique to provide more accurate clinical assessment and localization of area of interest. So this USG, it uses a sound waves to create the image of the body's internal structures, and it is widely used in the diagnostic tool in various medical scenarios. So this is the image of the USG machine. So starting with a display monitor, then the touch screen with option to select all scan functions and the keyboard, probes of different frequencies, depth adjustment and image zoom knobs, trackball, transducer connectors, central processing unit, intracavitary probe, ultrasound gel, color Doppler knobs, pointer and uni-interrupted power supply. So next, current and potential future applications of the USG. So nowadays the USG is widely applied in the field of regional anesthesia, vascular access, airway management, lung ultrasound and ultrasound neuro monitoring. So starting with the regional anesthesia, so the USG is mainly used or applied in neuraxial and chronic pain procedures. So it has become a commonly used modality in performing chronic pain interventions and procedures. So it allows the direct visualization of tissue structures while allowing real-time guidance of the needle placement and the administration of the medication. So this is the image where the ultrasound is used for scanning the brachial plexus. And this image shows the identification of the nerve and placement of the needle and administration of the local anesthetic drug to the patient using the USG. So next, the application of the USG in vascular access. So USG imaging indicates the presence, patency, position and direction of the blood vessels. So the advantages are identification of the accurate vein, detection of variable anatomy and intravascular thrombi, avoidance of the inadvertent puncture. It is also used in hemodialysis patient. Valves and thrombi can also be detected. It is used for localization of the central vein catheters and detection of the post-procedural pneumothorax as an alternative to chest radiography. So this is the image. Using the USG scan, we are identifying the radial artery. And next, the application of the USG in airway assessment. So airway USG can visualize and it can assess the airway parts like tongue, oropharynx, hypopharynx, epiglottis, larynx, vocal cords, cricothyroid membrane, cricoid cartilage, trachea and cervical esophagus. But there are a few parts which cannot be scanned using the USG like posterior pharynx, posterior commissure and posterior wall of the trachea. So these are the potential future applications of the USGs like prediction of the difficult airway, evaluation of airway pathologies, confirmation of proper endotracheal tube placement and ventilation, prediction of size of endotracheal, endobronchial and tracheostomy tubes, assessing and guidance for percutaneous dilational tracheostomy. Next, moving to the lung ultrasound, in a number of emergency situations, so hypoxia will require the appropriate and urgent diagnosis for its management. So the pneumothorax, pulmonary edema, pulmonary embolism and acute respiratory distress syndrome are the situations where the USG can be important tool for the diagnosis. However, it has got some limitations when used in patients with subcutaneous emphysema, pleural calcification and in the obese patients. So these are the potential future applications of the USG like diagnosis of the pneumothorax, diagnosis of the atelectasis, diagnosis of pulmonary consolidation and pneumonia, diagnosis of pulmonary embolism, selecting optimal puncture site for pleurosynthesis and optimizing mechanical ventilation. So next, moving to the application of the USG in neuromonitoring. So it is useful in assessing the elevated intracranial pressure and cerebral perfusion. So the current and potential application of the USG neuromonitoring are optic nerve shed diameter and measurement, transcranial Doppler USG, and pupillary light reflex. So coming to the maintenance and care of the USG, so these are the steps that has to be followed for maintenance of the USG machine, starting with check the USG machine daily and routinely. You have to pay attention to your ultrasound transducers, end of shift prevention, full system backup, schedule regular service for USG sum up ultrasound maintenance checklist. So start with the first step, check the ultrasound machine daily. Before starting the examination of the patient, ensure that all the connections of the ultrasound are plugged in properly. We have to look carefully at the integrity of the ultrasound wirings cable as well as ultrasound transducers. If you find any cut or frayed area, replace them with backup supplies immediately. Next step, pay attention to your ultrasound transducers. Perform a visual check of the probe and its connection to the ultrasound machine before each use. Inspect if there are any cracks or cuts on the probe lengths or on the TEE probe tube. Lastly, follow cleaning protocols. For instance, the sterilization of certain types of probes used for specific procedures. Third step, end of shift prevention. At the end of each shift, we have to wipe the ultrasound machine thoroughly and note any faults and issues that you noticed during the examination you performed. Remember to report any serious problem to your service respective right away. Full system backup. You should use to doing a full backup of system on a regular basis. This is important in order to reduce downtime if the system fails due to software and or hardware problems. By backupping presets, network data, options and other user preferences, carefully recover system within few hours. And next, schedule regular service for your ultrasound. Thoroughly clean the system inside and out. Cleaning of filters, intake grills, air passages and brackets is critical to prevent future failures. So filters on all ultrasound systems should be cleaned regularly. After removing the filters, make sure to clean the grain behind them as well. So proper maintenance of the ultrasound machines involve regular cleaning, disinfection and inspection to ensure optimal performance and the longevity. Key areas include the transducer, machine body and cables with a focus on preventing damage from dust, fluids and wear. Moving to the summary, USG is a unique tool which provides the anesthesiologist with diagnosis and monitoring capabilities, enabling optimization of peri-operative management. USG gated anesthetic procedures have given a new life to additional skills. Finally, procedural USG applications in the field of anesthesiology are numerous and improve the quality of care. So these are the references. Thank you.